All right, today's August 31st. This is the Makah EOC public briefing. We'll go ahead and jump right into it. Dr. Cope, you ready for your report?
Yes, Chief Bruner, thank you. Just pulling up my slides. All right. Okay, should be good to go. Good morning again. It's August 31st. Can't believe it's already the end of August. We've got 9 active cases in Nia Bay. We had a handful recover at the end of last week and over the weekend. So thankfully, my screen just go blank.
Yeah, we lost your PowerPoint.
Shoot. Okay. Let me see if I can pull it up again. All right, well, I'll try to keep talking while I'm trying to pull this up, but in any case, we have 46 cases total and 37 recovered, 9 active, and I'm just pulling the slide up so I can start to share again. Let me see. Not sure why this is so tricky each week. All right. Okay, am I back up?
You're back up.
Okay, sorry for that, everyone. I'll just keep going through the slides. So 9 active cases. And also on this slide, we've got 81% of our residents in Nia Bay who are 12 and up are partially vaccinated, which is great. Most of those are partially vaccinated because they're not due yet, or that gap between the 81 and 74%. Those are people who are just not due yet for their second dose. So I anticipate hopefully within the next 3 to 4 weeks, we'll be looking at closer to 80% of our residents 12 and up who are fully vaccinated. Of course, that is not 80% of our entire population of residents because we've got all those kiddos. And there, I think I saw some things about, just concern about getting to 80% or so, or what that means and why aren't we opening up as a community. And I just wanted to make sure that's on all of our minds, that our kids are still not protected, but they are protected to the extent that the adults around them get vaccinated. So if you're worried about your kids, the best thing that you can do for them, in addition to helping them wear masks and keeping them socially distanced, is also getting vaccinated yourself. So just gonna put that plug in there. And we're still in phase 1 of the Makah safety protocols. This is where we're currently at. We've got 1 person who's positive from traveling, 1 person who had an activity with a non-resident. So we don't know exactly how they got it, but that non-resident is also positive now. And so either we don't know exactly who got it from who yet, but we're trying to figure that out. And then another group of a household. That's what we're seeing. Collin County is still continuing to go up and is extremely high risk at this point. So the percent positive is 15%, which is quite high. And what, just to revisit real quick, what that statistic means is that there's likely a lot more people out there who are not getting tested. So we should be at or below 2%. And that means that the testing levels are keeping up with the amount of disease that's in the community. So 15% both means that there's a lot of COVID out there and that there's a lot more that we're probably not even catching, or that Collin County isn't catching. By and large, the majority of those are unvaccinated individuals. They do have 14 current hospitalizations, which is quite high for OMC, and they don't have any new recent fatalities, but certainly I'm just kind of watching out for that and hoping that they've got all the resources that they need in their hospital. The rate per 100,000 in the last 14 days has been 847, which again is incredibly high. And this is just a visual. So you can see they've changed their graphics, so it's slightly different, but higher than it really has ever been in Clallam County. And then Washington State, kind of reaching a little bit more of a peak and flattening out to where levels had been back in the end of last winter, early last winter. And then this is just another comparison from July 26th. So you can see where cases were increasing quite rapidly and hospitalizations and deaths had not quite caught up. And now we're looking at 3 times as many cases, but the change has flattened out. And so we can see that slowly flattening, still going up, but slowly flattening. And then hospitalizations and unfortunately deaths are still increasing. And this just kind of shows that as well. So this is the rate of new cases for all of the United States. Hospitalizations are also peaking and deaths are what we see as this lag right there. So they're anticipated to go up. These are the variants of concern in Washington State, and we get this weekly update every Thursday. This shows 77 in Clallam County, and as I've shared before, I'm sure that there are many more of the Delta variant, which again is highly transmissible and just seems to be spreading rapidly. As you can see by this chart as well, so nearly every single testing sample that's sent off for the genomic sequencing is coming back as Delta. So that's that orange. So what can we do about it here? We've got the Pfizer vaccine, which as of last week is authorized and FDA approved for use for 12 and up. So specifically the FDA approval is for 16 and up. And then yesterday, the director of Pfizer said that they will likely be finished with the trials for ages 5 to 11 by September, and will submit to the FDA for emergency use authorization that same month, and anticipated it'll be ready late fall or early winter 2021, 2022. We have all 3 vaccines available here at STIC. We've got Johnson & Johnson, which is the single dose, which is effective, not as effective as the Pfizer and Moderna. Of course, we've got first and second doses for those who haven't had it yet. And for those who had Pfizer already, we do have third doses for specifically been authorized for immune compromised. And we do have a list of those patients and have reached out and have done a number of those third doses. If you think that you fit into this category of immune compromised, please call us, call 2233, and we will talk to you about it. But we have called or gotten a hold of everyone that that fits that category technically, and we can walk you through it. But sometimes people's phone numbers might not be up to date, et cetera. So if you think we missed you, please just give us a call. We'd be happy to help with that. A couple of case and contact and isolation quarantine questions. So we have been using 10 feet, 10 minutes or longer, and just one person not wearing a mask. We don't celebrate, we do celebrate families. We don't separate them unless they request it, or it seems like it's the best thing, but certainly per their request. We don't ever force families to separate, and we are always looking out for taking care of kids and elders. The scenario, just to emphasize, there's often several factors that go into place. Sometimes household will have an upstairs and a downstairs that they can split into, or sometimes it just makes the most sense to get a cabin out at Hobuck, but it's really a case-by-case basis. And we are having in-depth conversations with those individuals. And I accidentally have 2 slides in here on this. And this is the last slide I wanted to add. Sometimes we can't get a hold of people or find them. So this is where it's really helpful. If you think you've been exposed, don't wait for a phone call. Just go into quarantine at your own home and give us a call at 2233 if you need assistance. We'll get you connected to the right individuals. You can also call me directly. I'm at 645-2224. Sometimes I'm on the phone already, leave messages, but I do try really hard to call people before I leave at the end of the day. But if you think you've been exposed, certainly you can just quarantine at home, and please reach out to us. there have been a number of instances where we've reached out to check in on people and either the phone's not working. Sometimes we talk to family and ask them to call us and still somehow the message doesn't get through. So just know that. And on that note, again, another reminder to follow the protocols, because sometimes people haven't been contacted yet who may have been exposed. And it's so important that we stick with our household groups and our pods at this time to really avoid accidental exposure. The rate of COVID right now is really high, especially in Clallam County. So going into a store without a mask, it's especially for an unvaccinated person, it's very likely to be exposed. So I just want to emphasize that. This is an update just on stick operations. I'm kind of putting my health director hat on. We are working on converting the blue trailer for treatment of COVID patients or COVID suspected patients. We have been looking into monoclonal antibodies and are implementing that treatment here. And that's something that can be done. It can be done via IV, but most recently we've been authorized to do it as a much easier type of single and injection under the skin. And hopefully we'll have that implemented quickly. We're still doing mostly telemedicine, except when in-person is needed. And certainly that is the case sometimes for preventive things and not just emergencies. And we're keeping that in mind. We are requiring COVID testing and screening before coming into the building for clinic or dental work. But we do have some outside tents set up and are working on having more hard-sided structures for some of the outside areas. And this is a back into my health officer hat. And I made this plea last week, but please, certainly if you're wondering what you can do right now, please get vaccinated. Please don't travel, especially on an airplane, unless you absolutely have to. And I understand that there are those times when you have to, but avoiding it right now is a really good idea. And then please wearing those 3-ply masks over the mouth and the nose at all times. And that's it for me. Any questions?
All right, well, thank you, Dr. Cope. I don't see any questions in the chat at this moment, so I'll just continue on. The Makah Tribe organizational update for today is council's reviewing the business applications and determining approval guidelines. There are also some applications that need additional information that they're currently working on. For the EOC update, I just remind everybody we're still in phase 1. So continue to follow those safety guidelines and protocols that we have in place. Be safe when you're traveling. Take necessary precautions and safety measures when returning home. Wear your mask, vaccinated or not. Also, a reminder that masks are mandated in public places and tribal buildings. We're going to have to continue to do this for quite a while or until we can get this under control. Please continue to check the stick.org website. It will be updated again today with this information along with this briefing and additional information in the near future from the weekend. Looks like one question for Dr. Cope. Will stick have a drive-through testing sometime this week?
Oh, yeah, thank you so much for asking. I meant to have that on one of my slides. We are continuing our testing, drive-through testing 1 to 3 p.m. every afternoon. And if we have any reason to do any expansion on that, we will certainly announce that to the community. But in general, we've resumed just our daily 1 p.m. to 3 p.m. testing. All right. And then we have a number of vaccines or appointments and people set up for Thursday afternoon. So we're kind of returning to that Thursday afternoon schedule, but we will certainly, if anyone is interested in getting the vaccine, can call down and make an appointment at any time.
Excellent. Group those vaccines together so we don't have any vaccines left over. So share that information with your family members and everybody else. So that's about it for the briefing today. I want to thank everybody. Thank you, Dr. Cope, all the stick staff for all the hard work you guys are doing. I want to thank the Makah EOC, the Makah organization as well. So a lot of work to keep everything continued and working throughout this time. We'll also want to thank the Makah Tribal Council for their support and everything and guidance. So you guys have a great week. Stay safe, and we'll see you this time next week. So thank you guys.